Hi, this is Rosel Cortez, and this video is for Pharmacology assignment 4. My answer to the first question is that I think based on the patient's actions and appearance, I suspect the patient could be suffering from a substance abuse problem and mental illness, such as schizophrenia, and this is commonly characterized by hallucination or might as well delusion. As the woman screamed obscenities without any particular reason is somehow a not a normal person should be doing. This may also impaired cognition, including attention, memory, and executive functions. The patient shaking hands and shouting for a bottle suggests that she may be seeking drugs or alcohol, which can further support a substance abuse diagnosis. Scraping her arm and face for no exact reason can possibly cause self harm to the woman. Also, poor hygiene, as stated in the scenario. Women's clothing is dirty and you can smell stale body odor and urine. Often accompanies certain mental or emotional disorders. Poor personal hygiene, such as failing to regularly wash, use deodorant, change clothes, as well as brush teeth, can be one of the first signs of a person that has a mental illness. Normal persons maintains it and has good personal hygiene and is important for both health and social reasons. It entails keeping our hands, head, and body clean so as to stop spread of germs and illness. That is why personal hygiene provide benefit to us, especially to own health and impacts the lives of those around us, which is the opposition in the people having a mental illness. They lose the value of their hygienes to their dissociation in the real world. People might think that there's no possible way to treat it, but there are a lot. Even the love and support of family and friends play an important role in schizophrenia treatment and recovery. If you have a loved ones with schizophrenia, you may be struggling with number of difficult emotions including fear, guilt, anger, and frustration. You may feel helpless in the face of your loved one's symptoms, worried about the stigma of schizophrenia, or confused and embarrassed by their strange behavior. You may even tempted to hide your loved one's illness from others, but it's important to remember that the diagnosis of schizophrenia is not a life sentence. Recovery is possible, especially with your love and support is really there. We often find them wandering in the streets, which they should not be because these patients may be prone to psychological, physical, and perhaps even sexual abuse. To cope with the wandering and its consequences in elderly, even the measures like use of locked doors at home with family provisions and care, physical restraint, and electronic device tagged to the patients has been advocated. In this case, they are lost. Sometimes people think that family of the persons wandering with mental illness do not care about them, but we should not judge immediately because we don't know what they're really still trying to find them and they just can't find them all. They can do was to post them missing and will look a long time in order to find them. And to those who just let their family members just get lost just because they're not normally thinking, do not let them just get lost. Instead, lead them to a facility where needed care and love can be given without harming. harming them because even though they are mentally inescaped, they are still family, and that is the fact that we cannot just throw away. For question number two, the short-term health risks that this patient faces include injury from her fall, further complications from her scrape and bleeding, and potential adverse reaction to any substance she may have ingested. In the long term, she may face ongoing health problems related to substance abuse, such as liver disease or addiction, as well as potential mental health issues such as anxiety, depression, and increased risk of suicide. For question number four, the patient's hands may be shaking due to withdrawal symptoms from a substance she is dependent on or due to the effects of substance she has taken. Her confusion and combativeness may be due to the effects of substance abuse, a mental health disorder, or a combination of both. Uh, the for question number four, the assessment that needed for this patient include thorough medical evaluation to address her bleeding and scrape, toxicology screen to identify any substance in her system, and a mental health assessment to determine the cause of her confusion and combativeness. A full medical and mental health history should be also obtained to help identify any underlying health conditions or previous substance abuse or mental health issues. I think you can help people that are suffering by this by also educating them, try to learn mental illness and its possible treatment, which allow them to make informed decisions about how best to cope with symptoms. Encourage your loved one to pursue self-help strategies, handle setbacks, and work towards recovery. And also, it is important to set realistic expectations about the challenges of particular mental illness, such as uh, schizophrenia. Help your loved ones set and achieve manageable goals, and be patient with the pace of recovery could be a great help not only to your family but also to other people who are also experiencing difficulty in looking for their family member who is having mental illness. And most importantly, empower your loved ones. Be careful that you are not taking over and doing things for your loved ones and that they are capable of doing. Support your loved one while still encouraging as much independence and self-help as possible. Encouraging treatment is and self-help in a cornerstone of helping a loved one with schizophrenia, while medication is an important element. Treatment, your loved one's recovery depends on other factors as well. Self-help strategies such as changing to healthy diet, managing stress, exercising, and seeking social support can have a profound effect on your loved one's symptoms, feelings, and self-esteem. And the more someone does for themselves, the less hopeless they'll feel, and the more likely their doctor will be able to reduce their medication. Your encouragement and support can be a crucial to your loved ones starting and continuing a program of self-help. Lastly, for the research question, answer is that mental illness management is typically approached through a combination of pharmacological and non-pharmacological methods such as therapy and support groups. Medications such as antidepressants, antipsychotics, and mood stabilizer may be prescribed to help manage the symptoms of mental illness. Therapy such as cognitive behavioral therapy or interpersonal therapy can also be effective in treating mental illness by addressing the underlying causes and providing coping strategies. Insurance coverage for mental health treatments varies, with some insurance plans offering more comprehensive coverage than others. Despite recent efforts to improve insurance coverage for mental health treatment, many individuals still faces barriers to accessing care, including high copays, limited provider networks, and pre-authorization requirements. And to make mental health treatment more accessible and effective, a number of steps can be taken. This can include increasing insurance coverage for mental health services, reducing barriers to accessing care, improving integration of mental health services with primary care, and increasing fundings for research into effective treatments for mental illness. Additionally, stigmatizing mental health and substance abuse and promoting early intervention and prevention programs can help to improve outcomes for individuals suffering from this condition. And that is the end. Thank you.